Welcome to the Clinic 3 final project where I, Casey Smith-Saxton, created a fictitious patient and presenting him to you. Put your hands together, ladies and gentlemen, for Bradley Cockshooter. Bradley comes to us from Clarksville, Tennessee. He was originally a member of our U.S. Armed Forces as an MP and a dog handler, served in Iraqi freedom, and then went back to start private contracting, doing security. Currently works for an ICE lab as a lab analyst. Was last cleaned in 2014, and at that time was a deep cleaning. He did not maintain that, however. Is having what appears to be quite a few gum issues as far as bleeding, some pain in his teeth and mouth. He also appears to have quite a few TMJ issues. Had a shoulder replaced and reconstructed. Has quite the list of meds. He also does need a pre-med before we see him today. That is provided by the VA for him, who did his shoulder replacement. He is allergic to sulfa drugs, codeine, and other narcotics. He currently smokes cigarettes and is not at all interested in halting that behavior. He also feels like he drinks about 2 to 3 drinks per night. He's allergic to quite a few things, which I'm sure is problematic in the military and also with a brand new shoulder. He states that his sleep disorder is that he cannot. He snores, has PTSD and anxiety, suffers from migraines, and feels like we should know that he does have erectile dysfunction. Bradley is on a slew of meds for high blood pressure, type 1 diabetes, anxiety, the ED. He also takes a blood thinner and has a pill that he can take before bed for insomnia. Here is a picture of his mouth at this time. Well, at the beginning of our treatment. This is a pano. It clearly shows you what teeth he does and does not have. Oh, I forgot to mention that Bradley does own a set of partials, but he does not like them. He was hoping that as part of the treatment, we could replace those for him. This is our initial finding. He does have an abscess on 6, 11, 21, and 29. And because he was unable to tolerate probing at that time, we just took a pano and prescribed him some antibiotics and scheduled him back to discuss a treatment plan for moving forward. Here are the intraoral photos that we got on that same day. And when he returned after taking the course of antibiotics, I was able to do the calc detection and plaque index. Sorry, my brain isn't working today. And as you can see, his mouth is 100% plaque and has supra and sub-G calc all over it. The Cambra shows us that he is actually quite a bit of a Mountain Dew drinker and has had quite a few cavities, especially in the last 6 months. He does not have a established dental home. It is not uncommon for folks who have gotten out of the military to have all the medical care, but it is super hard to get your teeth cleaned by the VA unless you are active duty or fall under a list of very specific things that can be tedious and monotonous and sometimes not worth dealing with. Brad does reveal to me during this filling out this Carrie's risk assessment that he feels like he does have a problem with alcohol abuse. He also states that he has lost some teeth in the past 36 months due to decay. Obviously, there is 100% visible plaque on his mouth. He does have some exposed root surfaces and also some interproximal restorations. I spoke with him after determining that he was at high risk for dental caries about limiting sugary drinks and foods to mealtime and not allowing sugar to sit on his teeth. We also discussed the need for an electric toothbrush and MI paste for treatment to be successful. I also recommended to him that on Black Friday they often have an electric toothbrush on sale, and that anything electric is better than anything manual. We were able at that appointment, second appointment, to do all the perio charting, and the dentist was able to recommend what teeth should be removed and what kind of work that the teeth that we were saving would need. And here is that charting. As you can see, there's quite a bit of bleeding throughout the mouth. Every single tooth had 100% bleeding. You saw how much plaque there was. Doctor recommended a root canal and crown on 29, 21, 6, and 11. You can see most of these pockets are pretty deep, with quite a bit of recession on each one. The dental hygiene care plan is essentially, all of his pre-existing conditions put him at risk for heart attack, stroke, the diabetes is possible coma if he doesn't control it, which he seems pretty well controlled. A lot of this decay in his mouth can be attributed to his already very sugary blood, in addition to all the soda pop that he drinks. Because he spent so much time out in the sun when he was in Iraqi Freedom and other tours, he does have quite a few sunspots. Obviously generalized sub-G calc, it's everywhere, calculus everywhere. Such a fun mouth to clean. Makes my fingers itch just looking at the pictures. The plan that I would like to do in clinic is to debride, hand scale, and just guarantee all that hard and soft buildup is missing. Provide patient with information about preserving his new investment, whether he chooses a new partial or a snap-on smile or an overdenture. It is going to take his commitment to keeping those teeth clean and healthy to maintain whatever it is he decides to invest in. The goals for maintaining those remaining teeth is to see him in 3 months and make sure the plaque is less. And at that time, possibly take some PAs of the remaining teeth just to see if they are maintaining the way we had hoped. First appointment will be to debride the entire mouth and then take impressions for whatever RPD he's interested in. Second visit will be deep clean. He'll also get teeth extracted that day. And then third visit is obviously to reevaluate. I feel like if he can get some of those pockets down to 3s and 4s, then there's no reason why we couldn't move forward with the partial denture. So, like I said, the first appointment will be to debride and take impressions for whatever it is he's looking to use to replace. Appointment 2 will be to deep clean 6, 11, 17, 27, 12, 22, and 29. Because he's doing a full mouth extraction, we will just go ahead and numb all of those teeth that day. I know that it's not recommended to do a full mouth, but we're full mouth extracting in the next room, so might as well get the cleaning done at the same time. Then the next step will be to reevaluate the teeth at every overdenture fitting, just to make sure that we are really not torquing any of those teeth as they're trying to heal up. That doctor's really satisfied with the bite, that type of thing. We're going to set up continuing care at that time. Also, the root canal buildup and crown will happen at some point in there. Right now it's scheduled for the 5th appointment, but really think it could be closer to the 4th. We would need an actual dentist's opinion on that. And here's the final look. Bradley chose the snap-on smile. It is a little more temporary, but it does make things more beautiful quickly. And it's more of that $1 million smile that people are looking for. I think an overdenture would have worked just as well. And that might be what he has to do as he gets older and if more teeth fail. Or even an implant-supported denture. I just feel like when you're actively a smoker and not interested in quitting, it makes it tricky for implants to succeed. And then I have my resource slide here. Thank you very much.